Thank you, Chairman. Honorable guests, ladies and gentlemen, good afternoon. Welcome to my presentation. I'd like to share the result of assessment on electronic health record adoption in hospitals across the mainland China. This picture shows the requirements and the resources changes in healthcare service in recent 30 years. The hospital visit and the budget per capita presents the requirement, and the employees and the beds in the hospitals represent the resources. You can see the requirement raises very rapidly in recent 15 years, and the resources increasing rate was smooth. So the hospital were pressed to overcome the gap. They need to serve more patients. In different periods, hospitals focus on different types of IT systems to help overcoming the gaps. You can look at the picture. In 1995 to 2005, the hospitals focus on CPOE and the billing system. And from 2005, the hospitals focus on EMR and EHR systems. From that on, more and more hospitals install the EMR or EHR systems. In 2009, China was entering a new medical reform. One of the focus of this reform is the implementation of EHRs. The EHR have potential impact on healthcare quality and safety, and it can control the cost. But the healthcare budget per capita in China is very small. The health IT budget in the hospital is also limited. In order to build EHR systems in more than 20,000 hospitals efficiently, we need guidance to help hospitals on implementation EHR systems. We also need to evaluate the level of EHR adoption. To evaluating the EHR adoption, the model of EHR grading is called MEG, was developed. The MEG was launched by the Ministry of Health in 2011. It is a two factors assessment method, that is the function and the usage. A detailed function items list was included in the MEG, that is the guidance for the hospitals. The MEG was revised in 2018. The third factor, that's the data quality, was added to it. This picture shows the workflow for inpatient service. It includes registration, admission, and inpatient physicians to give the order, and nurse station here, and include the operation room, exam, lab, pharmacy. The workflow of medical service have many points. The system with appropriate functions in the EHR should install in these points. The assessment will be made on these IT systems installed in the points. For the standardization, the MEG defined 39 standard functions, which are grouped by 10 roles. The roles include inpatient physician, nurses, outpatient physician, ancillary department, laboratory, procedure and ICU department, blood and pharmacy, medical record, EHR infrastructure, and data utilized. The function like CPOE, lab order, ICU, etc. Each function is the point for the assessment. The three factors in MEG can be found in the Information System Success Model, which is derived by DeLong and McLean. The function of EHR represents the system quality, the usage for the intention to use, the data quality as the information quality. Let's look at more detail at each function. The score of each function as well as the overall EHR level of the hospital can be graded in 9 levels. From 0 to 8 represents the function from simple to smart. The simple functions are for data collection. That's the level from 0 to 2. The middle level functions are for data sharing, the level from 3 to 4. The smart function include the knowledge base and the CDSS, that's the clinical decision support. The level are 5 and upper. Each function has a list. It gives a detail of the function. For example, the CPOE function, the detail is listed for each level. For level 1, the order should be entered to the computer, but the data can share by manually copying. And for the level 4, the physician's order should be transferred to all departments that need it, and the clinical decision support should be provided when entering the order. The usage factor is to see if the EHR functions are fully used. We calculate the application ratio for the EHR functions. That is the data treated by the computer divided by the data should be treated. So if the function is fully used, we can get a number 1 for 100% usage. The data quality factor is to see if the data collected and treated with good quality. There are 4 criteria. The first is standardization of the data. That's to see the data item is defined in the system. The second is completeness. That will see the required data item is recorded. The third is the integration, that to see if the data can be linked to each other in a related system. The fourth is the timeliness, that to see the data are treated in right time order. A qualified data ratio is counted. It is defined as the records with good quality divided by the total records. We can get the score of each function by multiplying the level of function, application ratio, and the qualified data ratio. Here's the example. One hospital CPOE system like this, the function level is 5, and the application ratio is 0.85, and the qualified data ratio is 0.9. So the scope of CPOE function will be 3.825. For each functions, we can do this. So the 39 functions, each one can get its own score. A high score of the function needs a system with high-level functions. The function be fully used and the data with good quality. We define the two types of functions, the core functions and optional functions. The overall MEG level of a hospital can be assessed using the score of the 39 functions. There are 3 criteria. First, all required functions must be installed. Second, the minimum number of option functions have to installed. And third, the minimal total score was counted. For example, one hospital got its overall MEG level 4, should get all 16 required functions installed, and a minimum 10 option functions installed. The total score should not less than 110. The MEG was used to evaluate the EHR adoption in mainland China from 2011. We spent 2 years to test the MEG method from year 2011 to year 2012. After that, from the year 2013 to 2017, the hospitals are encouraged to take the assessment. The tertiary and secondary public hospitals are required to take the assessment from the year 2018. The number of hospitals involved in the assessment are listed here. You can see the number of hospitals increased rapidly in the recent 2 years. And 1/3 is tertiary hospitals, and 2/3 was the secondary hospitals. An automatic system was used to treat the data in the assessment. If the MEG level in 1 or 2, the result will feed back to the hospital after the data were collected and the level was counted automatically. Level in 3 or 4, the data will be checked by an expert team authorized by each province government. Level higher than 5, the result will be checked by the expert team organized by NIHA, that's the National Institute Hospital Administration. In this case, some evidence need to be provided by the hospital and will be checked carefully. It is an annual assessment. The public hospitals will take the assessment yearly. In 2019, about 63% of the public hospitals took the assessment. It includes nearly all tertiary hospitals and half of the secondary hospitals. Now let's look at the result of the assessment. From the evaluation data, we can see the EH adoption was improved in recent years, especially the tertiary hospitals. So you can see the green one is for all hospitals, and the blue one is for secondary hospitals, and the red one is for the tertiary hospitals. The government expects, with the help of the EHR, the service quality of the hospitals will improve. In 2019, tertiary hospitals should reach level 3. Now we got it. In 2020, tertiary hospitals should reach level 4 and secondary hospitals reach level 3. The effort should be made to improve the EHR for the hospitals. Here is the histogram of MEG levels. The figure gives the data in recent 5 years. We can see the improvements. The high-level hospitals increased and the low-level hospitals decreased. The data in 2019 show that more than 30% of hospitals are in level 0 and level 1. That means more than 30% of the hospital are still have paper-based medical record, or they are using a standalone computer systems. And you can also see nearly 25% of hospitals are at level 2. It means the data can only be shared within a department. So we can see, although the improvement we've got, but hospitals still need to improve the EHR. Let's look more detail into the functions. The average score shows that some functions are widely applied in hospitals assessmented, such as CPOE, lab, or RIS. There are still some less applied functions, such as anesthesia system and ICU system. The functions related to the knowledge base are also need to improve. For an individual hospital, the MEG assessment lists the score of each function. So the function can be seen which one is better and which one needs to improve. The hospital can find the weak functions and improve it. Now we can go to a summary. The evaluation of EHR adoption was started in 2011. Now we got the 9 yearly assessment result. The data for year 2020 will be got at the end of this year. The result of recent year assessment shows that the EHR adoption in mainland China has made continuous progress steadily. But most hospitals' EHR in China just with simple functions. It is need to be improved. With the help of MIMTT, we can have a better insight for the EHR development. Like other countries, in China, the EHR systems are developed by many vendors, and hospitals will buy the systems and to apply it. The MEG also guide vendors and hospitals to build and apply a better EHR.